You're on mute.
Dr. Udita, over to you.
Okay, thank you, Dr. Sugat. So now it's my pleasure to hand over the session to our host for this evening, Professor Susuji Vikramasinghe from the Faculty of Medicine, University of Peradeniya, who will guide the sessions and the program and he will formally introduce our esteemed resource person, Professor Kosala Virakon.
Thank you.
Sorry, yeah. The session is
Thank you, Secretary and President. So good evening, everyone. So it is actually my duties to introduce our esteemed resource person, Professor Kosala Virakon, for today's webinar on Introduction to Scientific Writing. Professor Virakon is a distinguished academic currently serving as a professor at the Department of Parasitology, Faculty of Medicine and Allied Health Sciences, Rajarata University of Sri Lanka. With extensive expertise in scientific writing, research methodology, and academic publishing, he has played a vital role in mentoring researchers and guiding them through the complexities of academic publishing. Professor Virakon has made a significant contribution to higher impact publications, research collaborations, and editorial roles in the internationally reputed journals. With a wealth of experience in scientific communication, he has conducted numerous training sessions aimed at helping researchers effectively present their findings. In this session, Professor Virakon will guide us through Introduction to Scientific Writing. This webinar promises to be an invaluable opportunity to strengthen our research skills, from understanding the fundamentals to effectively communicating and writing our findings. Please join me in warmly welcoming Professor Kosala Virakon. Before we start, a few housekeeping points. Please keep your microphones muted unless speaking. Feel free to ask questions in the chat box or raise your hands during the Q&A sessions. These sessions will be interactive, so we encourage active participation. Thank you. So over to you, Professor Virakon.
Great. Thank you so much for that kind introduction, Dr. Uday, Dr. Sudat, and Professor Suji. And yep, welcome to this dual session program. Yeah, I think we can go ahead. I hope you all can see the screen, right? Yeah.
Yes, sir, we can see it.
Yes,
great. Thank you so much. And to start with, good evening to you all once again. So let's go ahead. I'll try to keep things very simple in this one. I know this is about generating our enthusiasm as well as, taking our brain towards orienting ourselves into research. This is the effort here. So at the end of the day, what I would expect is to sort of think slightly differently about what we see on a regular basis, on a daily basis, so that we can convert whatever the thing that we see on a regular basis in our daily routines to something important or a publishable thing, so that the rest of the world can understand or learn something from what we experience on a daily basis. So we are just trying to take it a little bit beyond from the clinical perspectives. So that's the whole idea. And as Dr. Sudat was mentioning, Dr. Uday was mentioning, I have been involved in a little bit of veterinary research, and I have a little bit of a relationship to veterinary faculty as well. I have done my master's in collaboration with veterinary faculty support. So that was a great opportunity, and engaging in key research in there. And beyond that, actually, all my research has been towards infectious diseases, mainly in human infectious diseases. But of course, when we are talking about human infectious diseases, there's something that we can't neglect or keep out, that is zoonotic infections, zoonotic diseases. So in that way, I have been dealing with lots of animal-related infections we commonly share with humans. But today, I don't need any of those technical aspects or technical perspectives to discuss this thing. This is about how we are going to think a little bit beyond on what we see on a regular basis, so that the others can make sense and others can take some messages and inputs to improve. Right? Yeah, just looking at some of the things that we see these days. Some recent news I'm taking here. A Nipah virus outbreak in India has brought back the COVID era surveillance. Right? So this recent Nipah virus outbreak in Eastern India have triggered a regional surveillance across Asia. So this is a bit of a, scary thing that recalls our memories about what we experienced in COVID, right? So then again, we are quite vigilant this time when it happens, right? And then we know Nipah is a zoonotic virus transmitted from bats or pigs, basically for humans. And it has a very high fatality. And as reported, it's about 40 to 70%. So this initial outbreak, detection of that initial outbreak led to contact tracing and airport screening and intensified surveillance. And I think we were alerted as well. And then we had our health systems active on this. And some of the most important global health research you can see start from a single animal infection. Right? We have ample of evidence where we see lots of globally prevalent infections or globally prevalent topics that we are talking have always started with a very small thing, probably with the case report. And just looking at this, cats give genetic clues to better cancer treatment, right? So these things this is a new comparative oncology related study, which found that domestic cats, our pet cats, share many of the same cancer-causing genetic mutations as humans, including in blood, maybe other organs, right? That opens pathways for shared treatments and research. So these are origin of all this is what we see, what you practice on a daily basis. So these are simple observations that started and expanding towards major research, right? So now I assume we haven't been into research much up to now. So now we are trying to think of how to enter, how to get into this arena of doing some research. I know we have, we'll discuss them later, but then I know we have some fears, stigmas in our minds about doing research, right? But then you will see at the end of this session how easy it will be if we fulfill a teeny bit of things within ourselves to do research and to publish our work, to publish what we see, to publish what we do on a daily basis, right? It's very simple. So that today I'm trying to just show you how we can convert our work, our routine work, into a publishable research, right? So here in this session, we are trying to recognize research opportunities in routine practice and identify publishable cases and understand what makes a good case report and prepare material for the hands-on workshop. So today, I'm focusing mainly on case report because simply every day we are meeting, we are handling these cases. So is it possible for us to publish this individual case? That's the whole thing. So that's the simplest thing that we can do. Before we think of planning, implementing a case control study or a cohort study or an observational cohort-based study, anything. Before we go into that one, this is something that we can easily try and easily get some satisfaction of getting involved in some research. So each and every one of us can do this. And as Dr. Sudat was mentioning, we have the SLVA sessions coming up, and at the same time we have the SLVJ journal, and all these are platforms for us to to present things and publish things and to expand beyond from there. I hope the sessions are coming soon, isn't it, Professor Suji? SLVA sessions?
Yes, we plan to open the submission on 2nd March, and yes, and planned the scientific session will be held on 7th August.
Okay, so once the submissions are open, it will be there for about a month or so, isn't it? Yeah.
Yes, we plan to open for 2 months period.
That's awesome.
Starting from 2nd of March and end is 30th April.
That's great, because I think, like, after this session, introductory session, we will talk about some practical things that we are planning to do in the upcoming hands-on session, which will be done physically in Peradeniya. So when you come into that one, we will discuss what we are going to do in there. So then you will be bringing some information so that we can try to convert all these into case reports and see how impactful things that we can generate through this information. So once that is done, actually, the platform is pending for you. So you can definitely submit those to SLVA sessions as well. That will be a very good opportunity for you all. So we have hands-on optimizing sessions coming up. So after that, you can work a little bit beyond that and then submit it to SLVA sessions so that you can make a good abstract in there. And afterwards, you can think of converting that to a journal article as well. So that's awesome. Very nicely aligned. So we can do that. Yeah. So this is the whole thing that we are going to do today. So what is research actually? Something that comes to our mind is, like, when we tell about a research, we just imagine, we tend to imagine like the laboratory setup, and then the chemicals and so many things, or else we are thinking of observing cohorts of cases, or else we are trying to compare drug trials. Those are the things that comes to our mind. But in simple terms, this is a very systematic answering of a question. We see something and we observe that very carefully, and then we just see why this is happening. What's happening? So simply, what we are trying to see is, if something happens, we just see whether that makes sense to us. Right? That's the key thing. Right? If something doesn't make sense to us, there can be two things. One is it's not fitting into what we know, and we can't have any understanding about, like, based on our knowledge, we can't work that out, what's happening there. So that could be due to either global ignorance, I would say. It is, nobody knows about it so far, so that it's something that we need to explore. Or else, rest of the world might know, but I don't know that one. So what I would do is, when I have such a question, I observe that carefully, and then I see why this is happening like this. Then, of course, I will read around that one. Modern days, it's very easy for us to get into literature and then read a bit around that, and then we might find answer in there. So that is the literature survey that we do usually. Whatever that happens, if we can make sense with our existing knowledge, means it's all right, all good. But if it is not the case, we read around that, we get expert opinion on that, and we discuss about that, and then see whether that makes sense. Yes, if that is the case, it's all good. We have improved our understanding. At the same time, we have made sense of what was happening. But if it is not happening, even if we read a little bit more, and then do a good literature search and seek expert opinion, still we don't make sense of that one, means there's a real problem in there. So that is where we would try to explore a little bit more. And we will do some scientific evaluation of that particular phenomenon or scenario for us to get a good understanding, good answer for that question. So that is what is making the basis for a research. And in our day-to-day practices, we might be seeing certain cases, right? Animals coming in with different manifestations probably, or else when we try to diagnose it, we have some dilemmas in there, new problems coming in, and we try to give the routine management options, but then it doesn't really work in there, some pitfalls in there. So then we can actually pick them as novel things and then go beyond exploring and reporting. So simply, this is a very careful observation and asking why, whether it makes sense to us. And then most importantly, it's about documenting accurately. Whatever the thing we do, if it is not documented accurately, it's going to be a major gap. And then it's definitely going to hinder our process, right? And then sharing lessons learned. That's what ultimately happening, whether you present that in a conference or whether you submit it to a journal and publish as a journal article, right? So simply, research is systematic answering of a question. It's a very careful observation and trying to see whether it makes sense for us asking why. And careful documentation with high accuracy, and finally trying to share these lessons learned. Very simple. It could be anything. It could be laboratory, it could be the field, it could be a survey or anything, right? Yeah. And then most importantly, our field practice is the real world evidence. We have, when we work in the field, that is where we have the real world evidence. That is the purest, best evidence that we have. So that is the one that should be reported instantly when we see some difference, because that is the one that generates or leads to significant subsequent expanded research. Right? We all know, as I was just mentioning, it's an integral part of our practice, of our discipline, in this case, in our day-to-day activities. And yes, as we have heard, there are lots of challenges around, right? Lots of challenges when we try to do this key research. But for us to start with, it's very easy trying to report what we see on a regular basis, right? There are so many misconceptions around when you think of research, right? It's not really only for universities kind of a thing, or it's not only laboratory based, as I was telling. And it's not dependent on complex statistics always. We can publish our work without a single statistical analysis involved in there, like in the case of a case report. And it's limited to large funded projects. No, there are eminent scientists. I have been, honored to work with them as well. These scientists, I know some of the scientists, academics, researchers who have published impactful research and who has been identified within the global best 2% scientists, who has never obtained a single grant purely based on their day-to-day clinical practice. They have published work. So it's very interesting. We can do all these things. So it's not framed within for universities. It's not laboratory always. You never need a laboratory sometimes. And it doesn't really need complex statistics always. And it doesn't really need lots of funding or lots of finances involvement. Nothing in there. And simply, purely, research can begin in the field where you work. Let's see how it works. How this can be important for us, like as veterinary medical officers, how this research is going to help us, why we should do some research. Obviously, the most important thing is whatever the thing that we see as important, and then if we really recognize that as something really, really important, which would be helpful for the advancement of science or veterinary field, it's something that the other people should know in the field. Rest of the world should know that, so that we should scientifically, systematically explore that, observe that, and document it accurately and report it. So the rest of the world knows, means it helps the advancement of science and the advancement of field, right? So that is the main thing in there. So advancing veterinary practice. It enhances evidence-based diagnosis and treatment, basically, when you think of your clinical setup, and also prevention and control as well, and expands knowledge on emerging diseases and health challenges. So advancing field knowledge on the field, right? And of course, if you do research, it will definitely help improving animal and public health in a local as well as a global perspective, right? It informs better disease prevention and control strategies and supports One Health approach to zoonotic diseases, as we're talking about. When you talk about One Health approach, we know that we are talking about human, animal, and environmental health together. That is essential. We can't singly think of either human health or animal health scattered alone. It should be integrated and then think in a integral manner, right? So that, yes, of course, this research will definitely help improving animal and public health. And another very important thing, recognition. Yes, I was telling about just before, I was just telling about about the global top 2% best scientists, right? That's a kind of a huge recognition, right? So you get it. It's about like your hard work paying off, right? You are recognized doing this research for a reason, because you have contributed really well to the advancement of science. You have some authority in there, some authenticated work you have done, and then that has significantly contributed to the rest of the world or the advancement of science or the field. So that's very important, right? And professional growth, like your promotions, nowadays so many things coming up in that way. And if you are part of academia, definitely this is going to be a very, very important thing. And even beyond that, it's very important part of your professional growth, right? So it builds credibility and professional visibility and enhances career advancement, and also for your continuous professional development. So you do research means you advance your knowledge, and you help advancing others' knowledge as well. So that's a massive thing that we can do while we work, right? And these simple evidence that we generate are the ones that helps our guiding our practices, right? If you think of a single scenario, single disease, anything, if you think of a decade back, how it was managed, how it was handled, how the prevention and control strategies were brought in, it's completely different to what you see today. It's simply because of this research-based evidence that we produced that has clearly guided these policies and practices, right? So our findings, our new information always influences evidence-based policies and clinical guidelines, right? And it helps If you do some research, if you get your own understanding on own findings, and we can definitely advocate the right place to do the right things, maybe the administration, maybe the political setup. You have the knowledge, you have the understanding, you advocate them so that they do the right thing. So advocacy is part of this. So you do research, you advocate the right place, right? And then, yes, it's about promoting effective animal welfare and biosecurity measures, as we see. I mean, aligning with sustainable development plan and the global goals as well, right? And then mentoring and inspiring. I heard we were talking about mentoring scientists. Yes, you definitely, if you have done your work and then if you have shown something and then its next level is you mentor your juniors, colleagues, and foster culture of research. That's what exactly we are doing here. We are sharing our understandings, we are sharing our experiences so that many are benefited, right? Yeah. Okay, so as I was telling, our daily work already contains research, right? If you look at our field practice, we always, I mean, very frequently come across a rare or unusual case. It's not every day we are getting very regular, usual cases. We are getting rare, unusual cases. Sometimes we just handle that, treat that, and then we take necessary measures for prevention control. But we know that is kind of a very rare thing. But then we are happy that we did it very well. We managed it very well. Probably we might go back and talk to our colleagues as well. Or maybe we might be just talking about that to our seniors or within our colleagues. We might be discussing about it. That day I got a case like this, and then, this is the first time I saw it, and then I was reading around that what I found was in this region we have never found this one even, and we just talk about it, but we have never thought of methodically reporting that and publishing that. And if you look back, if you think back now, just close your eyes and think back and then see how many such cases you might have come across. That is the ideal case report that would have been reported. And today we will know how to do that, how vigilant we are going to be on that aspect, and then how we are going to convert all these observations into methodical reports. Right? We'll talk about it. And of course, you see a disease, and then you try to treat with the usual medications that you do have. But then you see sometimes unexpected drug responses. Maybe it's not responding well. It could be a part of resistance that is coming and emerging. First time we are seeing. Why not we report that? And we see patterns of clustered disease events sometimes. We were talking about that Nipah virus outbreak initiated somewhere and then it was investigated and so on. That is the starter point, right? And then, yes, of course, zoonotic alerts and then management-related problems. You try to treat, it doesn't work, and due to many reasons around that, there are so many learning things, right? And then when you try to diagnose certain things, there are so many challenging things. That can be a very unique scenario. So all these are very important observations that we can report so that the rest of the world get to know about this, and then they can build up maybe the policies, maybe new research, everything from that simple observation that we make. Right? The difference is we do our jobs very well. I know we would pick the case, diagnose it very well, and then we treat them, and then we do the necessary referrals and then give the best care. But then it's about perfect, accurate documentation and reporting in a scientific and a methodical manner so that the rest of the world knows this better. Right? Yeah. So what can be published from field practice? Right? We can publish case reports. What is a case report? Very simple. The same thing that we do like an animal is brought in with some problem. So you see that as a special, and then you singly report that one. That is a single case, you report that one scientifically. A case report. And then a case series. A similar pattern of things under single theme. You see several cases coming in. Those are unique, having a similar pattern or some observation, so that you document them, you report them together, multiple cases. So that is a case series. And then you happen to do an outbreak investigation. Always outbreak investigations have newer information for us to look for. That's always a new thing. So you can always report that one. Right? And other short communications or field observations that you do, or treatment response reports, or anything you can do. And it's just a simple start here. And then once again, it's about precise, accurate, scientific, and methodical documentation. We'll see how we can do that. So why we need to start with case reports? As I was telling, we need to have, here we are trying to get into this one, get into the momentum of doing research, right? Trying to step into this arena. So we can't start with the, case control study. Lots of logistics, randomized control trial. No, we might not be trying to start with that one, with all the sort of complexities in there and the logistics involved in there. But if you think of a case report, we are just reporting a single case that we are handling on a daily basis. That is simply based on real patients. We don't need to do anything. You don't need to do any randomization. You don't need to have additional funding in there. Nothing. It's just based on real patients. It doesn't need any complex statistics when it comes to reporting a case report. You don't need. And our very well structured and manageable. And it definitely provides a good educational value, as we were telling, right? When it comes to like a rare or unexpected clusters disease, something like that. So it always have a very high educational value. And it's widely publishable. Many journals accept these case reports, right? And there are case report oriented journals as well, and dedicated for case reports. So this is the ideal entry point for beginners like all of us, right? So what makes a case report publishable? Okay, we have the case report, and then how does that become a publishable one? So we send a case report to a journal, editor look at this, and then editor doesn't want to, how we can ensure that the editor is happy to go ahead with the review process and try to see whether it can be accepted in there. So what are the things that we really have to have when it comes to a case report, right? So as I was telling, this is an emphasis of what I was just telling minutes before, right? It could be a rare or an uncommon one. It needs to be, either unusual in presentation, common disease, but the presentation is quite very unusual. As I was telling about unexpected treatment response, and the first thing, that is a sign of emergence of a disease, right? The first report of something in a region, probably. Right? And then educational for other practitioners. We feel that information will be helpful in educating other professionals. Yes, that's definitely. Those are the key things that we need to. Rare, one common one, unusual in presentation, management dilemmas, diagnostic dilemmas. Those are the ones that would be creating interest in editors to accept towards acceptance of your work, right? And finally, when we write a case report, it's very important. At the end, we write something called a discussion. We'll talk about it. When we write the discussion, the first paragraph in the discussion, we always think of writing the essence of the case. Why this case needs to be published. We are trying to tell that in the discussion, the first paragraph, we are first telling because of this, this case has these important points. Therefore, this is very important that we publish this one so that this can lead to important research, important policy decisions, or whatever. So that is the first paragraph of our discussion. If you read the first paragraph of a discussion, or if you read the conclusions, you see the essence of the case report. So when you write a case report, first you have to think of, okay, you do that, and then before we publish, we have to think of what is the key message that we are going to give in this one. What is the key message that we are going to give? So that we have to refine using all the information that we have, and then we have to give a very strong message through this report. And it should be very clear, precise message, right? So if you have a very clear, new, precise message embedded in this case report, means that is an ideal candidate to be published in a good journal, right? Just see, what do you think about this? Which of these might be publishable? Routine mastitis treated successfully. Got with unusual neurological signs and confirmed diagnosis. Unexpected failure of standard antibiotic therapy. And sudden cluster of abortions in one farm. If you think of the first one, routine mastitis treated successfully. I mean, that is kind of a usual thing. People know about that. And then we haven't noticed anything unusual, new, or unique in that one. A very well known thing. So that, I mean, that may not be the best or the ideal not to be reported or published. But if you think of the other things, there's a problem, right? Unusual neurological signs. This can be a newer variant of a disease or something. So we need to report that one. So you give antibiotics, but then unexpected failure. What does that mean? That can be a sign of resistance. Yes, better to report that one. Right. Sudden cluster of abortions in one farm. There should definitely be an underlying cause in that one. We need to explore that and then report that. Yeah. Everything, all these three, the bottom three, are NIV and then educational. I will have some questions at the end. We'll do some quiz. It will be very interesting. Okay. So we're coming into the basic structure. We are talking about the importance of a case report, how simple it is going to be. And then we'll see the structure of a case report when you are. I'll show you some published case reports here as well, so that you can go back and then read a bit as well. So we have the title as in a research article, and then we write a little background around that one. And then the core of the case report, that is the case description. And then based on that evidence, we do a discussion. And then, of course, the key learning points that can be a part of the paper, but then, of course, we are coming into the conclusion. So this is the concluding remarks are the ones that I mentioned here as key learning points, right? All right, so When we have recognized that this is an important thing to publish, what we usually do is we simply systematically, clearly, and very accurately, we document the entire thing since the time of presentation. If we can retrospectively trace any other information, relevant information, everything. And then what we did first, what were the investigations done, and then what was the treatment response for this particular case, and then how things evolved, what were the challenges, everything we write down. Like the way how we would be presenting this case, yes, in the clinical practice, how we would be presenting this case, we write down everything. And at the same time, the decision to publish this work, this is an important case, so that I need to publish this work. That decision best to be made while the case is being managed, not once everything is done and completed. So it's very important you are very vigilant from the beginning, and you're thoughtful from the beginning when you're handling a case, whether I'm going to publish this or not. Simply whether I'm going to make the rest of the world know better about this or not. That decision has to be made while you are handling the case or managing the case. Simply because you might get all necessary details around that. You can explore widely around that. You can read a lot around that when you are making that decision and doing that while it is being managed. It's very, very important, right? And then, of course, there are some ethical considerations about the consenting and all. So we'll talk about that. So for everything, it's very important that we make the decision of publishing while the case is being managed, right? So we take all the information in a sequential order, in a methodical way. So we write down that one. So once you write down the case report, now we find out, okay, we pick the key takeaways from this case report. Why we thought about publishing this? Because it is new in this sense. It's very unique in this sense. This is very unusual in this sense. So we have picked those points. And then now we have to go back to the literature and then read a bit around those key points. And then we try to make sense, compare things with the past things. And then we say like, okay, somewhere else in the world, this has happened, but it's slightly different to this. And then some other place this has happened, but then they have used this medication, but it's not available here, so that it couldn't be done. But then in our case, we used an alternative, it worked here. So likewise, we compare with existing literature and then argue on that and trying to make sense and then trying to generate newer concepts around that one. So that is our discussion. Right? First of all, what we do is we just report the case with all the details as much as possible in a methodical, scientific manner. And then after that, we read around that case with the existing literature, with arguments on trying to make sense, trying to generate, synthesize newer concepts around that. So that is the discussion. So we have the case report written, the case description, and then we have written the discussion. Now looking at all these things, we write a good background detail for the entire thing. Okay, this is about, this case is about this disease or this complication. And then, yes, we are starting around that one, going a little bit beyond that one, disease category, and then funneling it down towards the disease, specific disease that we are talking, what we know so far about this disease. And then what problems are there? And then how does this case would fit into fixing or minimizing the gaps between the current understanding, so that we are going to report this case. So that is introduction, funneling down. And then takeaway, after understanding all these things, we write down the best conclusions possible. essence of the case, what we know from the rest of the world's research, and then after all the discussion, what are the key points that we can tell from our case, and then what implications, what next can be done using this case. So the conclusion has the essence of our case, and then what we have found out from the reading in essence, and then what is next, implications. So that is the whole case report, right? And then after doing all these things, you can decide on the best catchy title for that. Everyone would love to read that one. It tells everything in a nutshell. It's a skill of putting the best title for your case report, right? Yeah. Okay. So it's very simple. You write down what you see, what you do, and then you read around the key points and you argue around that. So that is the discussion. And then looking at all these things, you write down a good background about the entity that you're talking about. And looking at all these things, you come into a very nice conclusion where you say the essence of the case, what you found through reading in a nutshell, and then what implications, what next from this case. That's all, right? It's very simple, very nicely structured, and a clear message in there, right? Yeah. So information, I was telling about, we are going to gather as much as information possible while the case is being managed, so that we have made, we can report it. So we make the decision whether we are going to report this or publish this while the patient being managed, right? So we need to document very clearly the species, age, breed, sex, the basic details, and of course, the farm or the region or the where it's coming from and all sort of things, the background information, history of the illness, and then the timeline, everything very sequentially documented. All the evidence as much as possible. You need to capture past photographs if there are any available before coming here, and also while the management things, the patient be managed, progression of the condition, if you can take photographs, as well as all the clinical manifestations, investigation findings, everything needs to be clearly documented, right? Diagnostic results, yes, and then whatever the treatments that you tried, and then how did it work, how did it respond, and then what alternatives you tried afterwards, and so on, right? And then it's very important you document things, observe things until the clear outcomes are reached, whatever it is going to be. Whatever it is, right? It could be whatever the outcome, whether it is a positive outcome or negative outcome. It's very important we get towards that outcome before we publish or report. We need to have all that information, right? Or if possible, we can take some caretaker perspective as well, what they felt about the entire process. That's a very important thing. So for that, for us to see the outcome, sometimes we might be needing some follow-up, right? So we keep in contact, we get their consent, and then keep in contact with the caretakers or whoever involved, and then we follow that up until the outcomes are reached, right? And as I was telling, photographic evidence is very important, very valuable, right? It will be very informative for everybody. And there are certain things that we should try and avoid. As I was telling, the exact opposite of I was just asking to do. Precise, clear, organized documentation. Please, never incomplete documentation, right? And if you don't try to synthesize a clear learning message, it's not going to be of much worth, right? And as I was telling, you don't go towards the outcomes and you don't collect data towards the outcome, it's going to be very incomplete, and you might not be able to give a good story around that, right? And never try to overinterpret findings. Just report what you have seen and then just try to tell what makes sense around that based on what you know, using the literature findings as well. And anything beyond that is a question. That may be the next question. That's the next research question. Right? So we live for that one. We never try to overinterpret things. Right? And then we got to be very fair about our conclusions, and even when you're thinking of implications, we got to be very fair about, what we can tell based on what we see. And we can't claim novelty, or we can't claim huge things going beyond the frame of what we have seen and what we have reported. We need to be within that, right? So the accuracy, clarity is critical, right? Yeah. So we're going to understand the scope of the framing of the case we are working on. And then when we are coming into conclusions, we cannot claim novelty without appropriate evidence. At the same time, we should not try to overinterpret our findings. So when we are doing the practical session next time, we talk about these things, why we might be sometimes doing over interpretation, why it is not appropriate, and then how mistakenly we might try to do that, and how we should avoid all these things. We will be talking in the next practical session. Right? So when and how we can claim novelty of a certain thing that we observe. So those things we will discuss when you bring down your information, when we are scrutinizing them, formulating into case reports, we will discuss about them. Right? And yes, we are nearing the end of this session. I will show you some case reports as well, and then we'll go for the quiz. And I will give you a briefing on the next session as well, right? It's very important we think about the ethical considerations, right? So we need to maintain confidentiality and obtain owner consent, right? It's mandatory if we are going to report, owner consent is taken, right? And we get to be, in honesty and integrity about what we publish. And then, of course, we never, think of altering or fabricating information. We always have the supporting documentation, supporting evidence with us, and then backed up by that only we are reporting. So professional integrity is essential, right? Yeah. There may not be barriers, cross-checks for those, but then it's about our professional integrity when we are reporting, right? Yeah. Some case reports, yeah. Like, see what this is not to go in depth and try to see what it is, but then this is about just trying to show you how people have published, what sort of things people have published, right? So anterior uveitis and uveal depigmentation in a dog with vitiligo. You know better than me about these things when I'm telling. I'm not an expert of any of these, but you see, kind of probably it's a rare thing. So they have decided on reporting that. And it's a worthy reporting, and it's gone in a good journal. And another. First report of hematosalpinx in a cat with a large hematoma and severe anemia. So certain complexity in there, and then such complexity first time seen. How do they claim this first report thing? They have searched literature and then seen whether there has been something like this reported earlier. No. For their understanding, yes, no. Right? Sometimes you submit this as first report of this thing to the journal, and then it undergoes peer review process, and the reviewers who read this and then come back to you sometimes telling, hey, you see, I have found several cases of the same type of a thing. So please never claim this is the first report. You can tell about the others, but not this first report, right? Sometimes that can happen. So yes, yeah, first report of this thing. Yeah, so I just wanted to show you structure of like, we write an abstract at the end. So we'll talk about that in the practical session. Here, as I was telling, you see the introduction of the case report and the case presentation, right? So this is about this one, first report of hematosalpinx in a cat with large hematoma and severe anemia. So in that one, you see the introduction they are giving hematomas occurring in the ovaries, uterus, and so they're talking about hematomas and then expanding around that, focusing on what we are presenting simply. And then we say, here we report a case of hematosalpinx in a cat characterized by large hematomas, because we tell the background and then tell what we are reporting here. That's the introduction. Of course, this introduction can be a bit more expanded than this, depending on general requirements, sometimes depending on actually what you have to tell. This length of this introduction would vary, right? And then the case report. See, it starts from a 6-year-old intact female Japanese domestic cat, weighing for and so on, starting from initial presentation, and it's going ahead in a sequential manner, how things happen, right? Blood test indicated severe anemia and so on. You report everything, right? And then some very, very valuable photographic evidence, photographic images of the investigations that was done. You can include them in there. Very powerful evidence, right? Especially when it comes to case reports, these are very important, vital. Right? There's some recording that it's all good, perfect. And you can see the real life photographs of how the surgical outcomes and all, right? You report that one and you link all these figures into the text, as you can see here, and then the discussion. As I was telling, you're just arguing the key points of your case presentation with the existing literature, right? And then the conclusion. So for us to be authors or the publishers of a case report while working in the field, it's very easy, but we need to be prepared. So every case we need to be vigilantly thinking, is this something that we need to report, something educational, something that the rest of the world will learn from this? So we need to be vigilantly thinking. At the same time, we need to be prepared for that one. Prepared, okay, for consenting, yes, we need to be prepared. We have standard consent forms and everything. So we need to be prepared. We need to be having them in our office with us, right? And then whenever we decide that this needs to be reported, one of the first things that we would say is we detail the thing for the caregiver or the caretaker, and then discuss with them that this is worthwhile reporting, and then we will make sure these are confidential information, and that is confidentiality is secured, and then these will be non-identifiable, anonymized, and then but the clinical details or the information will be shared to the rest of the world. So the consent will be taken inside that way, right? Yeah. So we'll talk about standard consenting procedures, consent forms, and everything in the practical session. And for you to report, organize your case report, this is a very important thing. CARE case report guidelines. You all can search in Google CARE case report guidelines. I will show you the CARE structures in the next practical session, right? Some more case reports. Cryptococcal meningitis in a goat. Yeah. Interesting pictures. All published in, the pictures of case reports. Seroprevalence of abortion-related infectious diseases and associated risk factors among brucellosis-free herds in northern central Algeria. Yeah. Can you see the screen? There was some problem.
Yes, we can see.
Yeah, sure. Sorry about that. Once again. It's taken to the link. That's why. Yeah. Right. So that's about that, and then preparing for the hands-on workshop. So before that, I will give you a quick quiz here. I'll give you a Mentimeter link. Give me a second. I'll unshare this one. Right. Can you see my screen now?
Yes, can see.
Yeah. So what I would do is I will share a link so you all can join through this one. And yeah, have you all received the link in your message box? In a Zoom message? Yeah, perfect. So you are receiving that. So you all can join. It's a very small quiz on what you are doing. Yeah, either you can scan this QR. So you can join through your screens. Yeah. Yeah, you all can join. You can put your own names, and then, I mean, it doesn't need to be your real name. Many can join. I think there are, so you all can join. If I don't know, depending on your facility, whether you can access it or not, but I'll wait a few more minutes so that others can join. Yeah, and then if you want, you can scan through this QR. If the link is not working, you can straight away take through the QR. All right, so I mean, yeah, okay. I'll give one more minute so that. It's a very simple thing for us to recall. Great. Okay. Right, let's start then. So others can actually, okay, some more coming. Yeah. So others can contribute while going on, but Yeah, we have the players in. So let's start the quiz. Just answer in your screen, right? Yeah. Clock is ticking. You can. Okay, so we are seeing something. And to the next. Yeah. Which of the following is best example of a publishable case? Routine vaccination visit. Common diarrhea treated successfully. Unusual disease presentation with confirmed diagnosis. Perfect. Yep. All correct. Yeah. There's more here. Which of the following is most important when preparing a case report? Using complex medical terminology or the jargon, having many references in there, detailed and accurate documentation, trying to publish quickly. Publishing quickly is also important, but then of course it all depends on your detailed and accurate documentation, isn't it? Yeah, perfect. Yeah. What is the most important first step to start research in field practice? Learning statistics before you start research. Good one to think of. Applying for funding and observing and documenting unusual cases. Writing to journals. Perfect. That is the starter. Very simple, basic. So that is the essence and then the takeaway from today, right? Yeah. Brilliant. Oh, yeah. We have the leaderboard coming in. See? Oh, lots of success. Right. Perfect. Oh, there you go. Yeah. So you all can clap yourselves for that and from me. Good. And yes, there's one more thing. In one word, how do you feel about doing research? You can use only one word. You are seeing a word cloud being generated here, right? So the interesting is the most frequent here. That is one of the research figures we are generating here through your responses. So this is we call word cloud. You know that one, right? So far we have 6 responses clustered into 4 responses here. It means we have multiple coming in. So yeah, a new one came in. Meaningful, essential, empowering, and then interesting has been the most frequent here. And comfortable. Yeah, you feel comfortable about research after this. That's brilliant because we are thinking of very simple things. We are not focusing on funding, grants, or proposal writing or ethical clearance obtaining or anything. We are not worried about any of these things because this is about simple case report publishing and then for us to generate our enthusiasm and do something worthwhile towards advancement of science and the field. Yeah, perfect. So if you feel it's very interesting, that's what exactly I wanted to see. And you feel doing research is empowering, of course, yes, you got the concept right. And you feel something comfortable about it, that's we would expect, right? And then it is essential, yes, it is essential. That is what makes next level guidelines, policies, everything. And even the treatment would be decided based on all this research that you start today. It's always meaningful. It's always meaningful. And of course, what is this two interesting here? Simply because a little typo there, right? Otherwise, it should. I mean, it's the most frequent thing, because this should be added in here, because this E is missing here, so that it's interesting, but then it's interesting. It is interesting, right? So, yes, as you recognize, I'm really happy that you find this interesting. That's the drive for us to work, right? Yeah. So whatever the thing that we do, if we can make it interesting, we will be very happy with it, and the outcomes will be very productive as well. Yeah. Okay. Great. So I will stop sharing this. Thank you for that one. And that's really nice that we could make it. Yeah. Let me share the screen once again with the presentation. So we are towards the latter bits. Yeah, you all can see the screen, right? Yeah. Yeah. Right. So so in the session 2, upcoming session, we need some preparation. I hope, Professor Sujay, I think, whoever will be joining for the next session, practical session, not come present today for some reason, and we should be able to pass this information to them as well. So it will be a productive session, the next one, right? So all of you here, we expect that you will be able to be there for the most important hands-on session, where you will be converting your important findings to publishable documents or case reports, and we will we'll spend hours helping for them, so you can make the best out of them, so that at least you can start publishing as abstract and then go beyond. Obviously you can do that for SLVA this time, right? So we need, we have about a 2 weeks time before we have the practical hands-on session. So try to identify 1 or 2 potential cases, as we were discussing, important cases that would be worthwhile publishing or reporting, right? Or if you don't find, there's a possibility that, sometimes you might not, but there's a high chance that you will get across something publishable during these 2 weeks. In case you don't come across, you just pick something interesting for you, and based on that, have your clinical notes, case presentation, and timeline of events, if possible, photographs if available, and lab reports of that, treatment details, outcome information, everything, as we were discussing about what needs to be included in a case report. So just go through the care guidelines as well, and you will understand what sort of information needs to be there. Basically, what you do on a regular basis, document them, write them down, and then bring it down about a case or 2, right? And then we will do the develop. Are there any questions about what needs to be done before the next workshop? Any clarifications needed about this one? hope it's clear. And yeah, we will, I mean, probably we might be able to form a group using who are going to join that, and then we can share some more information about that as well later. And in the session 2,
Dear
a
Professor,
structured draft case.
yeah, there's a question in the chat box. Is there any journals for dermatology only? I think Dr. Kaberi maybe is asking that question.
Yes. Definitely there are dermatology journals, but I can't specifically mention right now. But of course, we can do we can do we call this index search for potential journals, depending on what sort of a thing that we are going to publish. There are definitely subspecialty dedicated journals. And then when we are choosing the journal, there are things that whether we have some journals, we have the open access journals. That means everyone can access the journal articles and read. That is, the reader can read, but then author need to pay in that model, so that we need to pay. But there are some other options where author doesn't need to pay, publish, but then the readers will pay and read that model. So as authors, if we don't have funds for publishing, then of course we have to decide on what model of journals we are going to choose for. Right? I think SLVJ is a gold open access model where you don't charge from authors as well as from the readers. You can correct me if I'm wrong, Suk.
Yes.
Professor Peradeniya, yes.
Yeah.
Yes, that's right.
Yeah, so that's a gold open access, it's a very beneficial model for everybody. We usually do our local journals in the same way. In our journal, Anuradhapura, we have our Rajarata University Medical Faculty, Anuradhapura Medical Association Journal, JOT, Journal of Tropical Health. We have the same model. So we don't charge from authors, we don't charge from readers. We do a voluntary journal model. Same way, SLVJ, Sri Lanka Veterinary Journal. You can choose to publish on those. Like, that's the that is one important thing that we need to think of with depending on our funding availability. So regarding the original question about dermatology, of course, there are specific subspecialty specific journals that you can search in you can do an index search and then find out what exact scope of thing that you want to find, right? Yeah, definitely there should be. Yeah, all good. And any other questions or clarifications that is needed?
So if you have questions, the audience, you can ask right now, or at least you can post in this chat box. So,
Hello, Professor. I'm Janit.
Yeah.
I'm a small animal practitioner. I have a question. Now, you have mentioned in the presentation, research is not for universities, right? And there's a big barrier, I feel. Now, we feel that research is only for higher institutes. And I think you broke that stigma in your presentation. And what's the reason that the findings of research is not coming down to the ground level or the practitioners level? Is there any problem do you feel regarding that? The research that you gain at the universities and other institutes are not really disseminated to the lower levels?
Yeah, true. I mean, certainly, I completely again, thank you so much for raising that point. And at the same time, I agree with that one, right? So we see that sometimes impact research, the outcomes that you obtain, not always you see them in the practice guidelines sometimes, right? Yeah. So it's all about, as I was telling, the advocacy, right? So the researchers, the one who does the research is the one who knows most about the research at any given circumstance. And no one else is the one who does it. So he or she is the one who knows most about how best to explain that to the right person, right authority, right place for it to be implemented. Right. So that is what we call the research advocacy. So research advocacy is something we have to honestly accept, and that is something globally, not locally. Globally, that is something that needs to be improved. Right? Research advocacy. So we know the findings, we know the impact of that. That the person who perceives about the impact most is the one who does the research, who had read most about that one. So knowing that, we should be able to advocate the right place so that it is implemented, right? So that's a big process, but then of course we need to do that. But at the same time, when we think of the technical perspectives of how a research finding would come into ground level or the practice, it's like we need to, yes, we do generate scattered information, scattered knowledge, scattered understandings, but then all those needs to be systematically analyzed and evaluated before those being implemented or formulated as guidelines or policies. Sometimes what happens is, yes, we need, say for example, I'll take a medical medical scenario for this one, and it's applicable for veterinary research as well. Leishmaniasis in Sri Lanka. So nowadays we know human leishmaniasis, we see it's expanding. I mean, as a disease, it's growing, and then we need control and prevention to take place. We are taking different measures, but then we are not still trying any chemicals or anything towards vector control in this one, simply because we have some scattered evidence, but it's not enough for us to make the real judgments on that, because we have lots of challenges underlying, like the potential development of resistance and so on. So we need to be cautiously taking necessary action while we generate the right information. So what's happening right now in that scenario is we are generating right information, and then that, based on that, we are in the process of developing the national guidelines and the policies that is required. So depending on the circumstance, how the knowledge we generate coming to ground level practice would vary. And of course, as you said, there are gaps or the areas that needs to be improved, but then of course the technical process, it has some certain things that needs to be done as well. Yeah. Thank you for raising that. That's really important.
We should have a separate group of people to do that, to translate the technical stuff into towards laypersons. It should be their group, or can researchers do that, or the practitioners do that?
Definitely a combination, an expert committee would do that. Usually that's what is happening. Say, for example, in the example that I was taking, expert committee is gathered that has multiple stakeholders in there. So then they are the ones who would finally formulate that pre-test and validate and do all those things, and then finally come up with the applicable guideline or the policy. As you correctly mentioned, like it needs to have a mixture of stakeholders in there.
Okay, right. Thank you.
Great, thanks.
Okay, thank you. So any more questions? We can entertain one or two questions. So I will ask one question. I think that is maybe important nowadays for all these researchers, clinicians, and everything, because as Professor Kausal, most of this current we are using LLM, AI models to generate information and writing papers. What is the ethical side of that using AI in scientific writing?
So, and then, yes, yes, that's a very, very important thing. And modern days, actually, if you think of as a journal editor also, like what I feel is certain manuscript that's coming in, obviously, so, we can see LLMs used, large language models used, or AI used for writing these things. And then, of course, and that facility is there for a reason that needs to be used as and when appropriate. Right? So that needs to be used, and then it's about proper declaration of the use of that one. Yes, you use AI, but you declare that for this purpose, we use this particular LLM. Within the manuscript, we need to declare. Right? It's very important. We never can say that it can't be used, but at the same time, if you are generating something like, say, for example, a review article or something like that, if majority, now there are like how you detect plagiarism, there are plagiarism Turnitin and so many other plagiarism detection tools. The same way we can detect potentially AI generated information. So when a manuscript comes in, we can check that up as well. So before you submit your manuscript, if you do use AI, and then of course you use AI, but then you verify all that information as authors, and then modify as it is needed, and you declare that AI was used in this one, and then you can test whether you have accurately developed that manuscript. But anyway, when it goes to the editors within the journal, we will be checking the use of AI, and if it is not appropriately declared, we will return, and then you might be needing to do the needful in that regard. So use of AI, yes, as and when appropriate, we need to use it, and we need to declare that.
Thank you, Professor Kosala. I think we have coming to the end of the today's webinar. So thank you very much for your insightful presentation on scientific writing with a special emphasis on case report writing. We do believe that all can join our on-site sessions scheduled on 13th March at ICE Peradeniya. So I would like to invite our Honorable Secretary to give a vote of thanks.
Yeah,
Dr.
Professor,
Nitya.
thank you so much. And Dr. Dey, can I take 2 more minutes before you take the chance?
Yeah, sure, Doctor.
Yeah. Yeah. So yes, in the upcoming session, we will be developing a structured draft case report based on whatever the information that you're bringing in. That's going to be a very interesting hands-on session. So we'll have an initial introductory session, and afterwards we will team up, and then we will develop the case reports. So that's going to be a very interesting session. I think we had a nice session last time, isn't it, Dr. Uday? Professor CGV had a nice one. Yes, good.
Yes, we had this.
And of course, very important, someone was asking about dedicated dermatology journal and so on. I was just briefing on what factors we need to consider when deciding on a journal. So yes, we will have a comprehensive guidance on journal selection as well on that day. And of course, I will take you through the submission pathway. Submitting to a journal is kind of a process for a beginner. So we will take you through that journey as well. We will do a model submission. Up to the submission endpoint, we will take you, but we will not submit anything because we won't be submitting a real life one. But then, yeah, I'll take you through the process. So those are going to be very helpful for the beginners, the guidance of journal selection and pathway to submission and generating your own case report on the day, right? And yes, the publication is achievable. That is something we need to remember on the day. And I will give you, to wind up the day on the practical hands-on session day, an overview of expanding your research beyond the case report. So yes, we do the case report on the day, and then afterwards, what else you can do beyond your case report, what else you can do. So we will explore into that on that day. So that's going to be a very interesting and a very informative, comprehensive session So I warmly welcome you all and then invite you all to be in there. And whoever missed this opportunity to join this session, we will still be able to accommodate them in the next session. Thank you so much.
Thank you, Professor. Good evening once again. As we come to this end of this very productive session, it's my great pleasure to propose the vote of thanks. First, my sincere gratitude goes to Professor Kosala Anurakon for accepting our invitation. I think even the last year, as you mentioned, you conducted a very productive both online and physical sessions. So the success of that program actually led us to have you again for this year's program as well. And thank you again for accepting once again and guiding us for this very wonderful presentation. I'm sure that your presentation truly motivated our colleagues to do more research and to put those research into the publication. So thank you very much. And we will see more publications, especially in the Sri Lanka 78th annual scientific sessions. And also special word thanks goes to our president, Dr. Sugat Pemachandra, who is for his the leadership. His vision to have more and more CPD programs, I'm sure, will benefit the veterinary our colleagues and the profession, and not only that, the veterinary the livestock industry as well. So thank you for that. And for Professor Susuji Vikramasinghe, I think you are the main man behind this. I should say the man of the match of this program. And thank you very much for conducting, organizing this workshop, not only this one and also the physical workshop, and doing all the coordination work with Professor Kosala. Thank you very much, Professor Susuji. Not only that, thank you for expertly guiding this program today as well. And our special the appreciation goes to our participants for your participation and your enthusiastic willingness to join the physical program as well, because I have created I want to mention that also we have created a WhatsApp group. If you wish to attend the program on 13th, please join that using the link I have shared in this presentation. So we will be able to communicate better before the workshop. So I invite you all to join this program. So thank you very much for all your participation. I'm sure your participation inspires us to do more and more programs like this. And so thank you very much for again. So before we close, I think, as I mentioned, we have a physical session followed by this on 13th of March at Institute of Continuing Education, Peradeniya. And we warmly invite you all to join that program. I'm sure it will be a really productive program, as we have experienced in last year. So I invite all of you for that program. So thank you once again, and we look forward to seeing you in Peradeniya. And that concludes my vote of thanks as well as this program. Thank you, Professor Kosala, again, and have a good night.
Great. Thank you very much. Good night to you all.
Okay, thank you, everyone.
Good night, Professor. Thank you.
Good night.
Thank you.